Look at some commonly asked questions, frequently asked questions that I certainly get asked in the practice. So I want to ask Dr. Kraseman. I might do a few of these, and then we'll get into some myths versus facts, because I know you guys want to hear that. But let's set the record straight. Building trust and delivering truth. So let me ask this question to Dr. Kraseman. Is it true that changing your sleeping position reduces snoring?
I'm going to say sometimes on that one.
Please explain.
So people that sleep on their back, so in a supine position, have a higher potential to snore. In part, if you consider anatomically, gravity's pushing everything toward their back. If you're on your back and the muscles relax, the jaw and the tongue that's attached to it and all that musculature tends to slide back, and it can collapse the airway behind the tongue. So most people have a higher incidence of snoring or apnea events if they're on their back compared to their side or on their front. So, that gets into some of the potential kind of low-tech strategies. For people that primary snore, if they seem to only snore on their back but not on their side, one thing that they could consider doing is taking an old t-shirt and sewing a tennis ball into the back of it. It's low-tech, but if you roll onto your back, you won't even wake up. It'll just cause you to kind of roll back onto your side. Or sleep positioning, getting a wedge pillow, or elevating the head of the bed, or now they have these, albeit expensive beds where you can elevate your head. Most people have seen those on TV, and they show somebody snoring and the bed partner elevates them and they stop. It's not always that easy, but that's a potential option for some.
Wonderful. Yeah. I'm going to take this one. Is it true that homeopathic remedies reduce snoring burden? I have to say that is not true. There's just no data, and so I just can't be any clearer than that one. We just haven't seen data that homeopathic therapies help snoring. That's just how it is. If somebody's going to be trying to do that data, I'd certainly like to see it, but we just haven't seen published trials on people using homeopathic remedies for snoring. Would you concur with that?
I would. I haven't seen any compelling data in the literature that would support
wonderful.
That. Yeah.
Here we go. I like this one. Here we go, Dr. Kraseman. Is it true that using a weighted blanket can stop snoring in its tracks?
No.
Please explain.
I'm pretty unilateral on that, because the main thing with snoring, as I've said a few times now, is that it deals with airway, specifically upper airway resistance to airflow. So I don't see how putting a heavy blanket on the body below the area of interest would have any effect on it. So I think that's a hard no.
There we go. Here's one. I'm going to give this one to you. Why not? Dust bunnies. Is it true that dust bunnies and other allergens lurking in the bedroom, like ceiling fans, window treatments, bedding, and pets, can lead to snoring?
I guess indirectly. It's a pretty scary bedroom you're describing right now. I don't want to sleep there.
Yeah, I don't want to sleep in that bedroom either. It's like a lot of dust, a lot of allergens, all that kind of stuff. So say, let me ask you a quick question on this. So say somebody does have pet allergies in their if it's true, or a lot of dust stuff, but should they be allowing that situation, like if they have a dog, should the dog be in the bed if they have a dog allergy or things like that?
Well, so in general, and as ENTs, we also treat allergies. We test and manage allergies in my practice. For people with environmental allergies, one of the primary modes of treatment is allergy avoidance, which sounds obvious, but for some people it's not necessarily. So avoiding the thing to which you're allergic. The room that people spend the most of their life in is the bedroom. Most of us get around 8 hours of sleep, some a little less. So if you think of it that way, you're spending about a third of every day in one room. So if there's one room you're going to pay attention to in terms of trying to eliminate or reduce the allergens, it should be your bedroom. So if you have a pet to which you're allergic, like a dog or cat, we recommend generally that people keep that animal out of the bedroom all day, because that dander stays around even when they're physically not in the room. And for people with dust mite allergies, keeping the bedding clean, keeping the floors and the hard surfaces clean is really imperative. Because if you have an allergen-rich environment for an allergic patient, they're going to have symptoms. Swelling of the nose, stuffiness, that could make snoring worse, that could make sleep apnea worse.
Wonderful. Here we go. Here's the question. Is it true, Dr. Kraseman, is it true that doing mouth exercises reduces snoring?
It can. So what you're referring to is something that we term myofunctional therapy. Myo referring to muscles, and then the functional therapy part. So yeah, there have been some smaller studies that have demonstrated benefit to people basically doing certain types of physical therapy to improve the muscle tone of the throat and the tongue and the jaw muscles. One of my favorite stories, favorite articles, I should say, is a 2006 article that was published in the British Medical Journal that showed that 25 patients that underwent 4 months of training with an indigenous Australian instrument called a didgeridoo had improvement in their snoring and obstructive sleep apnea compared to a control group. So I'm not saying everyone should run out to the music store and buy a didgeridoo, but that's an example of myofunctional therapy that benefiting, and that's a novel way, so I just like that article.
Yeah, it's interesting what I read about this kind of therapy on exercises. I'm like, okay, you have to like do like tongue raises to try to work the back of your tongue and lift your palate, lift your soft palate up. If you can get your tongue further that way and stimulate that and give it some tone. Or there was something that I read about, oh, you should just lower your tongue into the bottom, to the floor of your mouth. And I'm like, I don't know how to do that kind of stuff. So I think so you get some mixed signals out there, but again, we're all about telling the truth.